I'm going to talk today about a safe and non-invasive treatment for chronic pain of the posterior tibial tendon. Now, pain of the posterior tibial tendon is a common cause of pain on the inside of the foot. The tendon is here. It comes down the inside of the leg and attaches to the inside of the foot. And it's a major supporter of the foot. It prevents that arch from collapsing inward. But it has a tendency to get injured because it works so hard at supporting the foot. When these injuries to tendon initially occur, it's something usually called tendonitis, an inflammation of the tendon. But tendonitis doesn't last for that long. Over time, that tendon starts to degenerate, gets little tiny tears in it, becomes thickened. That's a condition called tendinosis, and that can be very resistant to treatment. So we always want to try and get load off that tissue. We might use an orthotic device, sometimes in a boot. We might get you into physical therapy to strengthen the tissue. But if it just is not healing, then we need to focus on doing something to stimulate healing in that tissue. There's a number of ways to do it, but the treatment that has the best studies behind it for stimulating healing of tendon is something called shockwave therapy. This is an extracorporeal shockwave unit here. Extracorporeal means outside the body. And what we do is we take this handle, which has a little bullet in it that goes back and forth. And that bullet creates pressure waves. Pressure waves through tendon cause a couple physiologic effects. One of those is something called neovascularization, or formation of new blood vessels. The other one is something called release of growth factors. These are proteins that help stimulate healing of tissue. In a number of extremely well done studies, shockwave therapy has been shown to help stimulate healing of tendon. And in many cases, 70–80% of patients who otherwise were not healing will see healing within about 4 months after shockwave treatment. Usually we do one treatment a week for 3 weeks, and then you wait. Now, the upside of shockwave, it's completely non-invasive, it's safe, it's for the most part painless, and it's been extremely well studied on very similar tissues. The downsides of shockwave, it's slow. It really does take about 4 months to see the benefit. It's not like getting an injection, which can give you relief right away. It takes time to get that tissue to heal. Basically, what you're doing is you're taking tissue that has stopped healing and restarting that healing process. The other disadvantage is that although there are a tremendous number of studies on very similar tendon, there are no specific studies on the posterior tibialis. So we have to rely on these studies on other similar tendons. But we've seen good results with it. It's certainly nice because it's completely non-invasive. And certainly if you have pain on the inside of the foot that's not getting better, shockwave would be certainly a treatment that you would want to consider.